He's not there. No. Okay, so we're going to do this very fast. As we were talking about the 4 recommendations, it's not there. The first recommendation was about awareness, raising awareness and educating community members. So I wanted to share with you part of our communication launching campaign. What we are doing is already responding to that important need or that important recommendation that we were talking. So the way that we are doing that is coming back to the development of content, channels, and messengers. Well, they're testing my memory. Nothing on the, so you need to follow my English. Channels, content, and messengers. So we need to think in content. So what always we see a Hispanic, non-Hispanic, what are you doing? Always in the phone. So we need to think in ways that is something that for them is like a brushing the teeth every day. So we need to build content that is trustworthy, and that is something that we have been doing. We have pills of knowledge. We are right now recording some podcasts because we find a lot of information, but how credible is that information? How do we know that this information is recorded or is created for a professional that really is knowledgeable about these topics? So then we are talking about video podcasts that we are recording. We are talking about awareness messaging. What a better way than the bus that is coming, and different topics that we are creating around that. Then channels. What do we learn from Dr. Johnson? What is the number 1 channel? Facebook? Okay, Facebook. We're talking about people love to be in Facebook. How do you access Facebook? Most of the time, in your cell phone. So then how can we increase the access of this content in channels that they are already using? So then we had Facebook, we had the website, we had digital education, we had TikToks, we had YouTubes. So those are the ones that we had to use, and that is what we have been taking the initiative. And I know that many providers are doing the same, but it's important to be aware that we are on the right direction. So we are talking about radio as well, around 5,000 Hispanic leaders when we run a spot on Wednesday. So it's not just to do it, but it's as well to follow who are the audience at that time when you are running things like that. And then the trusted messengers that we keep talking about that. But now we already have the beat bus. I wanted to explain 3 things about the beat bus. Number 1, we are talking about transportation as one of the big barriers for our Hispanic community when we are talking about infant mortality. We have the bus. Number 2, we are talking about 46514, 46516 as the main zip codes with more infant mortality rate. Happened that this bus is in the areas of Elkhart and Goshen. Other important thing is that reached around 62,000 unique individuals in the course of 12 months. This is coming from the company, so this is the guide that they offer to us, and that is equal to 4.77 to 17 million total impressions. So message is seen between 77 and 560 times annually. So we wanted that we use this bus not just as an opportunity to teach, but also as an opportunity to say, I was in that bus. And if you notice in this bus, all these faces are present in Elkhart County, and I will say that at least 50% of these faces are today in this room. And we are so appreciative of their support. But before moving to that appreciation, I wanted to point this. Each time that you guys look at the tail of the bus, please count how many buses, like school buses, are around. If you remember, Dr. Weaver say, in the last 5 years, 2,700 kids have died before 1 year old. And that is a total of 37 school buses at full capacity. Those are 37. Ooh, you don't have to count anymore. I already spoiled it. But I wanted that is a message that is going to let you guys know and remind we need to stop filling up buses that are going to put at risk our babies, our future, our community. So that is very important. And now I wanted to invite our community members who help us here and wanted that all of you help me with a big round of applause, because I think that without them, we won't ever do what we have done. I wanted to invite Women's Care Center, Liana, Jennifer, Jessica. Muchísimas gracias. Thank you, thank you, thank you so much. Estas son las caras de nuestra comunidad hispana y son las caras de nuestro proyecto y de nuestra campaña de comunicación. Thank you so much. Those are our faces from the campaign. And if we were talking about contest-oriented content, this is the best way. Because these faces, every single face that is in the bus, are our influencers. People are going to say, I saw you in the bus, I saw you, your baby. So that is the idea, is that even though you are not in the bus, please, I invite everyone that is present right now to get on the bus and help me to give a big round of applause to every single person who is here. Muchísimas gracias. No, a ti. So it has been a pleasure, really, to be here. Thank you so much for your time. I know that was a lot of information, a lot of things that we need to digest, but we wanted to, as Dr. Weaver say, I hope that this is an opportunity as well of call to action and see what we can do to really move that needle. Because even though we are now with better statistics, still they are not good enough. So we can still doing our part, and I think that the best way is not working in silo. We need to build synergies. Everybody has a strength, everybody has the best of the hearts, but we need to find that glue that is going to make this a successful initiative. So thank you so much, everyone. We appreciate it. We have a final extra evaluation for the event as a whole. I think that is also something that they can do in the QR code, and you don't have to be present for winning, but thank you, thank you, thank you. I appreciate it, and that's it.